Good evening, everyone. I hope I'm audible. And I welcome you all to this very timely and significant session, which we are holding on the occasion of World Cancer Day. Now, before we proceed, let me tell you that the panel has been is an initiative of IHW Council. We are a think tank that works on advocacy, awareness, and behavior changes for a better and healthier nation in collaboration with Dr. Reddy's. So all of us are aware that today is World Cancer Day, and it is a problem that the whole world has been facing. In fact, we have had innumerable number of deaths because of this disease and everything. And World Cancer Day has been, commemorated for, to create awareness and better information on the disease, risk management, different issues of the cancer ecosystem management. So we are here with an array of experts who will be today discussing about the different strategies on cancer management, diagnosis, treatment, and all. So without wasting any further of your time, we should start with the session. And I'll just take 2 more minutes to introduce our experts for this session, which is titled, Yes, so we'll just start with the session, and let me start with the panelists' introduction. We have Dr. Piyush Bajpai with us. He's a senior consultant oncology, Manipal Hospital, New Delhi. Then we have, welcome to the show, Dr. Piyush.
Yeah, good evening. Yeah.
Good evening. Next, we have Dr. Raj Nagarkar. He's the MD, Chief Robotic Surgeon and Surgical Oncologist, SCG Manavta Cancer Center, Nashik. Welcome to the discussion, Dr. Raj.
Hello, thank you. Good evening, everyone.
Yeah. Good evening. Next, we have Dr. Safalta Bagmar. He's a senior consultant, medical oncology, Amrita Institute of Medical Sciences and Research Center, Faridabad. Welcome to the discussion.
Thank you, ma'am.
Next, we have Dr. Varun Goyal, consultant, medical oncology, Rajiv Gandhi Cancer Institute and Research Center, New Delhi. I think Dr. Varun will be joining us in the meantime. Moving on to our next panelist, we have Dr. Yugesh Kumar Nishchal. He's a senior consultant, medical oncologist, International Oncology Center, Fortis Hospital, Noida. Welcome to the panel, doctor.
Thank you. Thanks. Good evening.
Next, we have Dr. Shaunak Walame, consultant, medical oncologist, Jawaharlal Nehru Cancer Hospital, Bhopal. Welcome to the discussion.
Thank you. Good evening, everyone.
Good evening. Next, we have Mr. Sangram Sheikh. He's the commercial head, oncology business, Dr. Reddy's Laboratories Limited, Hyderabad.
Thank you, Dr. Modi, and good evening to everyone.
Yes, so it is a delight to have all the experts with us together on this very, very significant discussion. As we were talking about before the introductions, close the care gap. That is what, is being observed as the theme of this year's Cancer Day, World Cancer Day. So I'll just start with Dr. Piyush Bajpai. Dr. Bajpai, coming back to you, let's have a, when we talk about close the care gap, specifically when we are talking about a disease, which is as prevalent as cancer. What do you want to tell us about closing that care gap, making accessibility, affordability, and, cancer treatment, which by this very theme, we mean to say that it should be accessible to everyone, irrespective of their economic backgrounds, of their nationality, of whatever reasons. So please tell us some, more about that.
Yeah, thank you. Thank you for that question. I would just give an example of the recently, faced pandemic, COVID-19. And that's a very glaring example where, there were high-income group nations which had the accessibility to vaccines, and then there were some very low income group nations who were actually struggling with vaccines. So until unless the realization of the whole world was, and India stood, a champion in that, in providing the vaccines worldwide. So the whole message was that you need to actually have a, uniform cover. And that's what we're seeing in cancer, that high income group, countries in where they are having a better GDP per capita, there the cancer screening programs are very robust, and it's actually you have a better cure rates, better cost efficacy for the treatment is better realized. Whereas in India, or I would say other parts of the world as well, our country of course is facing a similar situation where nearly 2/3 of our patients are actually presenting in an advanced scenario. And we are not getting, and therefore we are losing a large number of patients. Number one, which could have been a win-win situation and had they presented earlier. And also the sad part is that it actually adds to a lot of cost to the treatment. So the overall, basically the late presentation, and there are reasons for that which we can discuss why in India there is a late presentation, or other lower middle income class countries. So that of course needs to be bridged, and that's why this is a very appropriate slogan in the current times. Yeah,
very rightly said, Dr. Piyush. And coming to you, Dr. Raj, since Dr. Piyush has talked about that, how a late diagnosis results in the patient already in advanced stages. So when we talk about diagnosis and screenings, where do you a lot of work has been done in the health scenario. If we talk about the last 10-14 years, there's Ayushman Bharat, National Digital Health Mission, and all that. But do you see somewhere there's a gap when we talk about inclusion of non-communicable diseases, especially cancer, in the overall broader perspective of things? Dr. Raj, over to you.
See, in fact, today afternoon, on occasion of this World Cancer Day, we had in our own hospital, we had a meeting with about 150 ASHA workers in the presence of this Honorable Civil Surgeon of Nasik as well as the Deputy Director of Nasik. See, there has been significant percolation as far as healthcare delivery is concerned and screening which is concerned because considering a country like India with a diversity, not only in terms of our religions, our languages, but even socio-economic diversity. See, ASHA workers, it is a wonderful, I'm sure that through this IHW Council, I would like to maybe take 30 seconds more. ASHA worker is that bridge between the patient and the caregivers which we are talking about. Each ASHA worker is given a responsibility of 1,000 people in her locality. And this is in remote areas. So she actually is part of those, say around 300 to 350 families, because there are 1,000 people which are there. And she is not a salaried person. She is not a government employee. She is more like a volunteer who is actually given a nominal amount. They get a 2,000 rupees per month of honorarium from the government of Maharashtra, and additional incentives, like if she takes a ANC, like an expected mother, if she takes her to the primary health center, she is given 200 rupees. On delivery of the baby in a normal delivery, she is given 500 rupees. And as part of that, they have taken up 2 more programs in Maharashtra. One of those programs is about reduction in maternal mortality. And now they are also taking up a program of those youth in the age group of 9 to 20 years as to how to get these youth back into the streamline. Because we have been talking about that mobiles are not good, or our youth is getting in between. There was a survey by the Global Youth Congress which said that in the age group of 15 to 20 years, almost 18% of the kids in our country are addicted to some form of tobacco consumption. Well, these surveys look good. These figures look like, but what should be done at the ground level? And I think ASHA worker is one such thing. And non-communicable diseases, which includes cancer, they have rightly so, they have highlighted only on 3 cancers. One is oral cancers, second one is cervical cancers, and third one is the breast carcinoma. Because all these 3 cancers, in fact, account for more than 50% of the cancer population of a country. And all these 3 cancers actually have a very long preclinical stage, where from the time they really start and by the time they manifest in the clinical arena, it is a period which goes on years together. They can be detected by very, very simple means and very, very cost-effective means. Dr. Bajpayee was rightly saying that the high income countries, including US or the UK, they apparently, I'm using the word, they were said to be having a very, very robust screening program. But unfortunately so, even in US, when it comes to detection of lung carcinoma, their screening programs have not been able to cover up more than 30% of the population. So having the means only is not the solution. We need to create an awareness and understand about the ground reality. As I said, if there is a lady who stays 200 kilometers from Nasik, the nearest cancer center which she has to travel is probably 50 kilometers or 200 kilometers. It's not about her traveling for a screening test. It is about she has to leave her kids behind. Who is going to take care of her livelihood for that particular day? There are problems like she has buffaloes or cattle at home. Who is going to take care of them? So we need to understand the ground reality. Only then a screening program will be able to deliver the desired outcomes which we are looking forward to.
Right, Dr. Raj. Very rightly, you have talked about how we can, when we talk about ASHA workers and how in the primary healthcare itself, we can try integrating those, strategies. Coming to you, Dr. Safalta, since, Dr. Raj talked about how women are not very, and he rightly told about how breast cancer and cervical cancer are the 2 most prevalent kind of cancer when we talk about especially women in India. So how, and then of course there's this stigma, taboo, related to women in India do not come out and talk about, reproductive health and things like that. So, integrating ASHA workers in a way, because they are, when we talk about self-diagnosis, talking about breast cancer and all, early screenings and all, how ASHA workers can be, since I've talked about, they can be integrated in a very proactive manner in that sense. So will they, they have a role to play in awareness creation as well as attitude change also. Your take on that? How can that be, taken care of?
See, even the educated females, not about like villagers, it is like educated female, they have the taboo to get against like getting screening done. In fact, like in our hospital nearby RWS, these females came today, and it was like very few females turn up because they were very afraid to how they can tell to their family members that they are going for a breast cancer or cervical cancer awareness session. So it is there at every level. It is not about just village or a poor family or poor or society. It is like all everywhere. It can be high class, it can be middle class, lower class, everywhere. So what we can do, it is like more and more awareness lectures right from the school. It is like I told them we will go to colleges, we will go to the schools where we will make the high school girls, high school boys aware of this thing, colleges, so that they will pressurize their parents that this is important, because the family members, they listen to the kids when they are talking sensible about these stuff. And ASHA workers everywhere, the person who can reach to the places around, like NCC cadets. I have been making NCC cadets aware so that they can go home, they can reach out to many areas and educate people. So that's how. And a cervical cancer vaccine that is there, and it is like 4,000 and 10,000 rupees. That is not possible for many people to take. But thankfully, India will be having a generic vaccine, which will be 400 rupees cost, and soon we'll be getting that vaccine.
Yes, that is soon to be rolled out, right? Indigenous produced vaccine, right? Thank you, Dr. Safalta. Coming to you, Dr. Shaunak, since you've talked about how accessibility is an issue, women do not want to, even men or, people don't have, they do not want to go for screenings and all, because it might be a long process for them. And during COVID, we have seen how digitalization has helped in saving the time of both the patient as well as the doctor. So you think when we talk about cancer and a better ecosystem for cancer care management, how can digitalization and technology ensure that and work as an accelerator?
Yes, with the help of digitalization, maybe we can create more awareness videos that can reach out to the interiors of the country. Again, I'm sure there will be difficulty in reaching them, because lack of video phones will also be a problem in the interiors. But when I agree with Nagarkar sir, because we worked together before, and we used to have outreach programs where we used to go from the hospital into the villages to hold camps and conduct awareness programs, so that we can kind of influence people to come out on their own. And we had mobile or mobile vans which had screening mammography, which could be conducted at the villages rather than calling them here to, say, a tertiary care center. With regards to how to utilize ASHA workers, especially with Poonawala's vaccine coming out, we can just, if we had a very robust pulse polio program, if we can incorporate the same thing for cervical cancer, that would be a game changer for our country.
Can I add a point over here, Dr. Ben?
Yes.
But while talking about incorporation of artificial intelligence into screening modalities, I'm very happy that at our center recently we have taken up a pilot project with a UK-based NGO, and that was for screening for oral cancers, the accessible anterior oral cavity cancers. And in the first part, we did 500 subjects, not only cancers, but they involved all precancerous as well as tobacco-related oral scenarios. Each individual, we took 9 clinical photographs. They were photographs taken on a mobile phone. So in total, actually, we took up close to 4,500 photographs were taken. And it was a surprise to me when the IT team, they came back to me with this thing that based on those 4,500 photographs which we gave them of 500 subjects, they had created close to 300,000 algorithms. And now the second part of the project is we are going to have photographs of 5,000 subjects, which includes melanocorplakia, leukoplakias, as well as tobacco pouchitis, aphthous ulcers, up to cancers. And based on 5,000 subjects, they are looking forward to develop close to 3 billion algorithms. And the target is by the end of 2024, there will be an app which could be downloaded on your Android or iOS phone. And similar to the retinoblastoma screening program, which is doing very well in South India, we intend to have an app where the individual patient, I think most of us have smartphones in a country like ours, where there are almost 80 crore individuals using mobile phones. They just need to take a photograph of their oral cavity, a selfie of the oral cavity in the app, and the app will tell whether it is pre-malignant or malignant and what should be the way. For the first 500 subjects which we do, we got a sensitivity of close to 94% and a specificity of 83-84%. But I guess 500 is a small number when we are talking about a mass screening program. But AI is going to influence us for sure and much earlier than we would have anticipated it.
Yes, sir. And I'd just like to add even the incorporation of digital pathology. If we can
Absolutely.
ask the ASHA workers to just take a pap smear and then upload the images, and we can access pathologists at the tertiary care center.
Right.
Dr. Shaunak, coming to you, Mr. Sangram.
I have one question before getting to my question. So Dr. Nagarkar and Dr. Shaunak, or all of you, just wanted to understand one thing. The kind of population that is being suffering or diagnosed with the cancer as in disease, have you noticed the overall split, whether they come from the urban sector more, or it is like rural sector is more? How is it? Or it's uniform across the all the categories?
See, unfortunately, so if you look at, I practice in a place like Nasik, and I guess most of my colleagues would have a similar experience as well. We have patients coming across whole of North Maharashtra, South Gujarat, up to Thane district.
Okay.
So we see around 30% patients are those who are from Nasik district, and around 60%, 50 to 60% of our patients are those upper middle class or middle class and above, which are there. In our country, in fact, today morning I was just going through some stats. We have close to 785 districts in our country. And out of 785 districts, only 20% of the districts in our country have a cancer center where surgical oncology, medical oncology, radiation oncology, all are available under one roof. So unfortunately, 80% of the districts of our country, our fellow Indians have to travel outside their district place to take care of to address their health issues. So it is a very, very different scenario as compared to most of the other middle income or high income countries in the world.
Okay. So do we have a situation wherein, as I was listening to Dr. Bajpayee also, here the diagnosis and early diagnosis become extremely tough, because most of the people don't know, are they suffering with a cancer because of the screening infrastructure not being available, and the people have to travel for longer distances. So basically what I'm trying to understand, what the patient pool we are seeing today, which is having a footfall at a clinics, the actual prevalence is much more larger than what we are saying?
Yeah, absolutely.
Yes, of course. We are probably just that's the tip of the iceberg.
Okay.
A lot of them are not being reported, as Dr. Raj rightly said, that, how do you capture this data? You capture this by cancer registry, and it's a cancer center which is having the cancer registry. So this is how it happens that you are missing a lot of it because they are not even coming to the healthcare system most of the times.
Absolutely.
Right. Dr. Piyush, I'll come to that, on cancer registry availability of proper numbers and all, because until and unless we have those numbers, how can we integrate our, system and coverage schemes on that? Coming to you, Mr. Sangram, since we have talked about how, every expert said that awareness creation is an important area when we talk about early detection, which can which can be a game changer in bringing down the mortality rate and numbers. So, a lot of awareness creation is being done by civil society organizations, and even pharma companies are doing that. So specifically, if we discuss about what has been Dr. Reddy's, work around that awareness creation and more information being, disseminated at the right level.
No, thank you for this question. And I think it's quite interesting discussion. I think I have picked up quite a decent points, and which is very surprising for me that the most of the patients are not actually reaching for the early screening. And 2/3 of population, what Dr. Bajpayee said, is actually having advanced stages where they're getting detected. The screening becomes extremely important. And I think being a part of the pharmaceutical industry last so many years, I think I have been a part of in my previous career towards the vaccine and some portion, and today I'm into this particular space. Now, what I have realized is Indian pharmaceutical companies always having two different challenges. One challenge is how can we make the medication available to the patients at a much more lower cost, because that is very important. And the second most important thing, which is like becoming extremely important nowadays, how can we have our own, not only the pills, but pill plus kind of initiatives. In our language, we say it's pill plus. Now, pill plus is something which is all related to how can we connect to the patients, how can you drive early diagnosis, how can we influence lobbies, intermediators, all the partners in terms of infrastructure to drive for the early screening and some kind of diagnosis to happen. Now, within the organization, we have one entity which is works towards only the social cause, and we name them as the DRHFE. It's an entity which is related to Dr. Reddy's foundation, and the title of this particular entity is Awareness for Life. We call it AFL, Awareness for Life. We operate in different disease areas, and one of the most important things that we drive is how can we go and reach out to common people, make them aware about the multiple therapeutic areas, diseases, and how can we influence them in terms of coming forward for the screening and early diagnosis. Now, we also have taken certain initiatives along with the Indian Cooperative Oncology Network. What happens most, if you look at, as Dr. Nagarkar said, that you have only 20% of the districts available infrastructure in terms of treatment for the cancer kind of diseases. So therefore, the physician becomes extremely important where most of the patients are having footfall. Unless and until that physician, even if he doesn't understand how to go for treatment, at least he need to understand what is the patient is suffering through. Unless and until we can help him to understand and at least have some kind of initial diagnosis and direct the patient appropriately, I think it will be difficult for us to have a proper screening. Early screening is taking place. So we have certain initiatives taken towards in collaboration with oncology, cooperation, by which we can create some kind of awareness among the physicians as well. A few months back, we have taken a one step. The breast cancer, as Dr. Nagarkar said, is one of the most prevalent kind of cancer in India. Now, if we have to really, and I appreciate Dr. Safalta also mentioned, it is not about the educated or non-educated. Every woman or every individual actually having some kind of reluctantness, some kind of compromises when it comes to healthcare. In India is all difficult country altogether because respect for us as a human being is quite low. Okay, if something goes wrong, we don't go and seek treatment. We try and suffer to a greater extent. And once the entire situation becomes extremely difficult, then we go to the doctor and say, okay, please have a look at me, what's wrong with me. So this time what we have done, if the women is not interested to go out and get some kind of early screening done, we have decided to go for one campaign. This is the Be the Better Half. Okay, so Be the Better Half, we are trying to influence the male community, husband community, the man of the house community, who can actually become responsible center, who can actually take the lady of the house, women of the house for the screening. And this is the sensitivity that we are trying to create amongst the Indian men, that you should be responsible for getting the early screening done. Now, it sounds a little different, but unfortunately, Indian society is such where the women of the house always land up compromising to the greater extent. So this is the thing which we are trying to drive. We are using social media. We are having some kind of association with oncology associations. We are also trying to tie with the multiple organizations by which we can take this particular initiative to the greater level. So this is what the initiatives we are doing. We are having quite a decent balance in terms of making affordable treatment, as well as getting some kind of awareness among the masses, Dr. Moini.
Right, very rightly said. When we talk about cancer, even when you're going for screenings and family support, caregivers, they form a very important part of the whole ecosystem. Coming to you, Dr. Yogesh, what about, since we are talking specifically about, partners and how family help and caregivers, you think counseling is also an imperative part of the whole journey, What is your take when you see patients coming to you at third or fourth stage? And yesterday there was a talk about how palliative care is the need of the hour. So what is your take on those issues? Over to you, Dr. Yogesh.
Thank you. And thanks for this discussion today. Um, Counseling is important part, and counseling begins right from the very first time anybody sees a patient who's unfortunately going through this journey. So anybody who sees, can be any medical staff, paramedical staff, I think if they are trained to do so, so that positive counseling needs to happen right in the beginning. So whenever somebody comes to our clinic, that's how things start. You take, what we normally do is, what is their ideas, what is their expectation, and what's their concern. It's a small thing, but it goes a long way to deal with majority of the aspects. So if you do a good counseling, and counseling entails not only telling about the disease or telling about the management, it's about exploring the other dynamics of their family dynamics, for example, their social dynamics, their financial situation. It's a wholesome thing. It's a holistic approach. And I think if you take a decision by taking everything into account and keep focus on the patient, I think that's important, very important, right from the very beginning. I think guidance, good guidance, right guidance, and talking about everything, so that, because whenever somebody comes in, I'm talking about majority of the patients who don't have enough, so that they can come easily and get anything they want. It's important to address all these issues right from the very beginning, so that they know that everything is being taken care of in a way, at least people are talking about it. So I think counseling has got a very important part. Absolutely.
Right, very rightly said. Coming to you, Dr. Piyush, you talked about how, cancer registry ki aapne baat ki, all the states do not have it as of now. So, and numbers do play a very important role in that sense. So, how can we work on that? What are the regulations that can be put into place to ensure that, since you said that it's just the tip of the iceberg, we do not know about the actual numbers. How do we tackle that challenge? You are on mute.
Dr. Bajpai, you're on mute.
So basically, as we understand that cancer diagnosis is actually, it starts from the microscopic diagnosis, basically. Once the pathologist diagnoses it, and there is this click button which the pathologist can always escalate. And there are programs which are, which are there to integrate these diagnoses, which the pathologist all over the country, in a form of network, can escalate such cases, that is reported as soon as they see malignancy. And this is how would one way to increase, the missing numbers, probably. Of course, other part of it is motivating the patients to understand the red flag signs, and the individuals about the red flag signs, and that's all about awareness. That's what we are talking today. On a World Cancer Day, increasing the awareness in the public that if not screening, then at least you should be aware of any new change in the body and report it immediately. That is something which the public should be made to understand. So this is one way which we can, increase those numbers. And yeah.
Right, Dr. Piyush. Coming to you, Dr. Raj, you talked about how tobacco consumption is one of the major risk factor. So when we talk about awareness, we are specifically talking about awareness on diagnosis, early detection, symptoms, and things like that. But what about, talking about the prevention aspect, or there is not, we don't say cancer is not essentially a lifestyle disease per se, but then there are risk factors involved, and a healthy lifestyle may eventually help in, in lowering the risk. What is your take on that?
In fact, I'm part of I won't call it as NGO. It's a social initiative which we have taken as Nasikars. We call it as Join the Change. And as part of this initiative, it has been started with the lot of motivation from senior IPS officer Mr. Ravindra Singhal sir. The thing is, we went to various schools, colleges, factories, and we have personally interacted with these almost 60 to 65,000 individuals in Nasik and in the nearby talukas. So we talk about tobacco awareness. So when does tobacco consumption start and why does it start? It starts at the age of 12 years, 13 years, 14 years. We have seen kids as young as 9 and 10 years old eating gutka or tambaku or smoking bidis. And we ask them, why did you do and how did you start off with? The answer used to be, dad takes it, grandpa takes it, uncle takes it, teacher takes in the school, and many a times the elders in the family or the teacher in the school gives money to the student telling that go and buy it out. So while bringing it for them, it all starts like they start consuming from that. So that is one part, along with the curiosity that if your dad, if your uncle, if you're doing it, probably it is right. Then when they reach that stage of 9th and 10th standard, the peer pressure starts taking a toll. Where if you don't smoke, we have heard, I was very surprised when I started hearing these sentences, ki bachcha hai tu. So if you are not smoking or consuming gutka, the seniors start bullying you, saying that you are a bachcha. So this particular kid feels like I need to prove to them that I have grown up. And how do I prove it? I start consuming gutka tobacco. This was one part of the story as far as tobacco is concerned. The other part, forget about the rural population. Even in urban city, in the corporation run schools in a city, there were almost 30% of girls who did not know what is a sanitary pad. And they were using cloth for during their menstrual cycles just because they were unaware. See, it's like, we've always said the sanitary pad. Is it costly? Of course not. It cost hardly, not more than 8, 10 or 15 rupees a month. One menstrual period would not cost more than 10 or 15 rupees, which they would easily spend as a pocket money. That much they have. We are not a very, very poor background society. But they were not aware. So we started an initiative that 3 months, we have started supplying them sanitary pads. And we realize once they start using it, they will never go back to the cloth. So it's all, we've always been saying that awareness. I have been into private practice and I think most of my colleagues and Mr. Sangram also would agree. Awareness, we have been talking about awareness for last 3 decades.
Right.
How much more are we going to speak or yell which is falling on deaf ears? It is not a problem about lack of awareness. It is a problem with the society that we are trying to tell them, but we are not giving them solutions for that. So I think we should stop talking about creating awareness. We should start talking about giving them solutions to the problems which they have. In our clinics, I'm sure Dr. Shaunak, Dr. Bajpai and all my colleagues would agree with me. It is a pathetic scenario that if we see close to 8,000 new cancer patients per year in a place like Nasik, how many of them are in stage 1? Less than 5% of them. Less than 5% are in stage 1. How many of our cancer patients are screening detected cancers? Very few. Most of them who come, okay, I've noticed a lump for last 6 months. I've had cough for last 4 months. I've been taking AKT for a couple of months. But how many times do we come across a lady who says that I was doing my breast self-examination, I noticed a lump today morning and I am here in the clinic in the afternoon.
Right.
So probably more than awareness, it is now a point of time where we should talk about giving them solutions to the problems which they are aware. I think 9 out of 10 patients whom we see, they know that they were suffering from cancer for last 6 months or 1 year. But why they did not come forward to it? Because there were other aspects about that socio-economic scenario that needs to be addressed now.
Right.
Right, Dr. Raj. Dr. Safalta, coming to you, we have talked about awareness, and then social media and internet it has ensured that whatever problem, self-medication is also an issue these days. So what about myths and other stereotypes that are associated? Like awareness is there, but then there's a lot of misinformation also. And especially when we talk about cancer, even in there are cliched stereotypes, and where we see that, there's a very negative kind of connotation that is there with a disease like cancer. And then there are myths also. So have you seen that happening more often than not in your practice? And how do we address that?
See, myths, every one of us, every cancer specialist who are there around, they have been seeing almost every patient entering into our OPD, they have some or other myths related to cancer. Today only a patient came in and she was having a lump for 6 months, and it was that they have decided that जो भगवान चाहता है वो करेगा. And then I did not say anything, and it was like she was 45 years of age and I advised mammogram. They were like कि हम x-ray नहीं कराएंगे, उसके radiation से भी cancer होता है. So I advised just ultrasound. They said I asked them to get a biopsy done. If there is something abnormal, then they said no needle should be put. That will increase the cancer. Fine. I did not say anything. I just advised get the USG done, and later on I'll do the counseling thing whenever there is a malignancy, suspected malignancy on the USG. So each and every patient, especially for the needle biopsy, is the most important myth they have come up. And they are like, patients are roaming around, they are doing doctor shopping just to hear that a doctor will be willing to treat a patient without doing biopsy. And for that, they have been spending 3-4 months roaming around. So they will all agree in the panel that they have been seeing these myths in their practice.
Right. So counseling can be a major support of that myth busting.
Yeah.
Right. Thank you. Coming to you, Dr. Shaunak, talking about the whole cancer ecosystem in a more broader way. Do you think there's a need of an integrated approach where, you know, every stakeholder needs to come together? Because we have seen work is being done, but then work is being done in a very siloed manner. You know, government, public is doing at another level, private initiatives at another level. You think there is a need for an integrated approach, a comprehensive approach where all related stakeholders come together for a better cancer care ecosystem?
Yes, most definitely. And one of the most important aspects is that everything should be available at one center. If you're expecting a patient to travel 200 kilometers from one district to your own, and then at the end of the day, he cannot find or he cannot undergo all the testing at that center, then again, the more he runs around here and there, the more he gets, more he gets frantic enough to stop seeking treatment at all. So it needs an integrated approach on multiple levels, that each of our facilities must be incorporated with all the relevant testing modalities. Also with regards to, say, government health schemes or financial support also, all the hospitals should be backed up with all the players that are there in the market, whether it's pharmaceutical companies or the insurance companies, which can help in easing the burden for the patient undergoing the test and the treatment.
Thank you, Dr. Shaunak. Coming to you, Mr. Sangram, what about, technological innovations? If we talk about how the whole cancer care space is being revamped and newer, like they talked about artificial intelligence and digitalization. So if we specifically talk about what has been Dr. Reddy's initiatives around research and development of cancer care and management.
This is a very tough question to answer, but I can certainly tell you how the Dr. Reddy's is trying to gear up. All of us are aware of the kind of overall multinational companies' involvement in terms of research and development. The kind of talent and kind of infrastructure they have is something which is unbelievable, and therefore probably we always see the multinational companies, but I think Indian companies are catching up. I think, name a few, I think there are quite a decent amount of research happening in some of the Indian multinational companies, and of late, we have also taken this research and development very seriously. So we have developed an arm like Origin, who is also working on currently CAR T-cell therapies, which is complex therapy management. And it takes a lot of time and efforts and patience, and which Dr. Reddy's have realized it. When we're trying to create a solution, I think it has been appreciated. And in the beginning of my earlier question, when I was answering, I think cost of the treatment has become extremely important for patients to ensure that the adherence happens, they take the treatment. And I think cost is also equally important for us to ensure they, along with the R&D, even if some of the research molecules are going off patent, it's an opportunity for us to manufacture, create that infrastructure within India, make the medication available at a much more economical pricing. That becomes extremely important. So of late, we have been last 3 years, we have been extremely conscious and serious about it. And I think there are two molecules we have got manufactured in-house now, and probably both the molecules will be available in the marketplace in a very short space of time. So this is what the initiatives Dr. Reddy is taking. I think lot many things to come. I guess it definitely attracts a huge amount of investment, and everyone has to be extremely conscious about the efforts goes in the right direction in terms of we definitely have a molecules explode in near times to come.
Right. Thank you. Coming to you, Dr. Bajpai, talking about how, if we talk about close the gap and then creating awareness on cancer, somewhere down the line, what is important is that the patient needs to be at the center of things. A patient-centric approach needs to be there. The focus should not be the disease, but the patient. What is your take on that?
Yeah, absolutely. I think so. Dr. Raj had really summed it up very nicely that of course, you need to look into why is the patient or the someone being diagnosed with this problem not coming to the healthcare facility or is not able to come to the healthcare facility. Those barriers need to be addressed, and I think so. Someone did mention also about health insurances and the cost of the treatment, and of course sometimes it is like people have resources, but probably they are not knowing what, or probably the physicians are not able to diagnose at times what the problem is, and therefore that means the curriculum in MBBS, let me say that still needs to evolve to actually inculcate how to look at these particular symptoms and posting of oncology, which at times is very small duration in MBBS times. So I think so that was covered by Mr. Sangram, that ICON group and groups like these are actually educating all of us, or also go back and talk to our GPs and tell them that this is what is to be done. However, other things are there as well, that sometimes the communication, the language, most of the literature or most of these communication are in English, and World Cancer Day or advertisements are in English. So the local language milieu is very small, and
Right.
that sort of material is also sometimes lacking. So all this needs to be looked into. Yeah.
Right, very rightly said, Dr. Piyush. Dr. Raj, coming to you, since we don't have much of the time left, but before calling it off, I'll just ask each one of you, because we did, owing to paucity of time or for whatever reasons, if you have anything as a when we talk about cancer care ecosystem, way forward action, since we talked about how awareness has been created, it is now time to take action, for the steps ahead. So your closing remarks on that, Dr. Raj.
I think I would appeal to all those patients who have gone through the treatment and who are now victorious and who are cancer free. I think we should not call them survivors. They are more like, they are warriors who have gone through the battle of cancer. They should come forward. I think what India needs is more of success stories. Unfortunately, those who go through the treatment who are absolutely fine don't want to come in front of the society to showcase themselves that, yes, I had cancer, I'm fine, I'm absolutely okay. If that starts happening, the stigma associated with cancer will go away and patients will be more proactive. Okay, I have symptom, let me go ahead and I can be cured like XYZ person over there. And about cost we were talking about, I think fortunately, whether it's the Ayushman scheme or the state government schemes, more than 90% of the patient treatments are covered under these government scheme. More than 90%. 10% I do agree, whether it's like immunotherapies or targeted therapies or CAR T cell therapy. But I think what India needs is more of basic treatment, but complete treatment. It should be a complete treatment. There is no point in giving trastuzumab or pertuzumab for 3 cycles where the patient gets exhausted and cannot go through the surgery or the radiation part of it.
Right.
Right. Dr. Shauna, coming to you, what would be your closing remarks?
Closing remarks would be that to bridge this entire gap, it needs to be bridged both ways, from the patient to us and from us to the patient. So both of us, both of the healthcare facilities as well as awareness programs need to be stepped up. And as Nagarkar sir said, it's time to just take action rather than just create awareness. Screening, one of the biggest banes of our country, unfortunately, is the population barrier as well as the education barrier. So if we can incorporate that somewhere into the screening programs, it will be much more easier to cover. I mean, we are the 7th largest country. Why are population screening programs better in Europe? Because each country is smaller than our individual states. So right. One is the population coverage that needs to be also addressed, and that is an important part of closing the gap.
Right.
Very rightly said. Dr. Yogesh Nishchal, coming to you. Anything you would want to add to the whole discussion?
Yeah, I mean, India is very diverse, as we all know, and there's a lot of difference if you talk about classes or talk about rural setup and our tertiary setup. So I think we have talked at length and we have highlighted the issues. But it's, as Dr. Raj has said, to find answers, to get solutions. How can we get people who are ignorant or people who are fearful of not talking about it? Things like social stigma, they don't want to come out of this, don't want to show up. How, despite knowing, we were doing in the afternoon as well a webinar, and people were talking about, despite there is a picture on the cigarette carton saying that you will get this, but still people go and take it, buy it. I mean, how do you remove that? I mean, what else can you do? So I think we need to think about all these factors because everything starts from there. So ignorance, fear, social stigma has to be addressed in one way or other. Whether there is a person, a role model in the community who can address those things, or we send out Anganwadi workers or ASHA workers, or we go or we reach out to the rural areas. But we need more and more of that kind of thing to try and get people to know about it first. Yeah.
Right. Since like Dr. Raj talked about, patient support groups coming together, and then we have, I think that change has already started happening, because we see celebrities coming out with their stories, and so that stigma, that taboo that used to be there has somewhat not there now, and there's a lot of change that we can expect in the coming time. Dr. Safalta, coming to you, what is your...
Can I just make a short remark over here? The unfortunate part about celebrities is that after Sanjay Dutt went through his treatment, Ashona could agree, every patient was walking in, sir, wo immunotherapy lena hai, go chemo वगैरह कुछ नहीं लेने का है. So I think celebrities have to be common man celebrity has to be there.
And plus, all the celebrities, they end up going to Europe and New York to take treatment. If they can take treatment with us, we have equivalent cure rates. It's not that treatment is not available in India. We have everything. But
interestingly, what Dr. Shorik is saying is right. But I read in a Marathi newspaper, Sharad Pawar, it seems because of his mouth cancer, he had gone to US. So US entire team of oncologists, they said, why you have come here? Okay, we are only making medicines, but all the best of treatment options, you can find it in India. So he was actually sent back to India for the treatment. And this was unbelievable. I was not aware of it. I just read that Marathi article sometime back.
Right, very true.
We do need celebrities, but we also need learned celebrities who are actually able to give time and come out and talk about it, not just highlight and sit back and don't do anything about it.
No, absolutely, because the Indian people's mentality, because normally we observe people's behavior, how their approaches toward the healthcare. So this is what we have been doing for the last so many years. Unfortunately, there are only specific elements of the society actually could manage to make the impact on the people. So of late, I have seen only Amitabh Bachchan could manage to make that particular impact. I think he is the one who actually could manage to do the TB campaign very successfully. I think we need to, what the take home is, like, though Dr. Moini did not ask me what is your, I don't have a closing remark, but I have a one take home message from all of you, Dr. Bajpai, Dr. Raj, Dr. Yogesh, and Dr. Sapalta and Shaunak. All of you are great in terms of bringing all the insight that you could manage to see in your day-to-day practice. I think there has to be a lobby which need to be formed in an association with oncologists in India. Probably we need to reach out to some of the impact-making individuals and try to tell them, okay, sometime you need to do this for the society and come up and try to do these campaigns for us. I think that's a take home I'm having as a task for me. Okay, if it is possible for me to do that, and somehow I'll just try to create such kind of infrastructure by which we can bring in such kind of personalities to bring in influencing masses by which they can take things seriously.
Right. That would be very useful because we Indians tend to take our celebrities very seriously.
So we don't listen to the doctors, we don't listen to the parents, we listen to the celebrities who are on a screen.
Herd culture.
Very rightly.
True.
You have something to add to the discussion?
Like once I was listening to John Abraham, and he was telling some mechanism of lipid in heart and how it causes heart attack. I was just thinking anybody can get influenced by John Abraham rather than the fat cardiologist explaining anything.
Right. That is what we call misinformation. And that's the beauty of social media, in fact. We have information and then we have misinformation.
Right. That has to be monitored, that the celebrities are saying the right thing.
Yes. That
they only get to know it after speaking about it.
At least they get.
Yeah, you're right, Samalta. I saw that video and I thought, how this is going to happen.
And on the lighter note, I was listening to Dr. Raj, and on the lighter note, when I was 5 years old, I started eating tobacco, and my father saw that, and then he stopped.
Wow. In fact, that's something which needs to be really coming forward. In fact, what happens that we are talking about celebrities. It also happens because almost 50 to 55, 60% of my patient pool is from rural background. I think most of you all also would be having a similar part.
Right.
When they see someone like a celebrity going to US and getting treated and back fine, they read it either on social media or newspaper. They even tend to develop a feeling in their mind that, okay, I have cancer, but I cannot afford that treatment. So why unnecessarily should I go to the hospital? So it actually has a negative impact. On the contrary, if you can have a daily wager as a success story, that, okay, look at this daily wager who had cancer, went through the basic treatment, and yet he is able to take care of his day-to-day activities and take care of his family, that would have a much bigger impact. But as I said, that would be more appealing. When we receive donations as a hospital, we receive a lot of donations. I feel that more than someone who has given a donation of 10 lakh rupees or 5 lakh rupees, I value that donation of 100 rupees from the person who has given. Because if someone who has given 100 rupees, he has actually done a lot of service to society because he has sacrificed something for the 100 rupees. Someone who can give 5 or 10 lakh rupees, he doesn't need to sacrifice something great. So the smaller values need to be brought forward, and hats off to Dr. for admitting on this platform. But I guess every daughter, every son, even if tries doing this in front of their father, I think lots and lots of our parents would quit tobacco or alcohol and that would indeed bring or add value to the health of that entire family.
We hope that happens, and with that we come to the end. I would just take this opportunity to thank all of you for this very, very insightful discussion, and I'm very sure our audience will take a lot of relevant information, which will, which they'll pass on to their family and friends for a safer and, approach towards cancer. And instead of just commemorating it for a single day, let's, we hope to work all the year round to just initiate this much needed change in the whole cancer care ecosystem and management. Thanks to Dr. Shaunak, Dr. Safalta, Dr. Yogesh, Dr. Piyush Bajpai, Mr. Sangram, and of course, Dr. Raj Nagarkar for your very, very useful insights and for taking out time for this. Thank you.
Thank you. Thank you very much.
Thank you.
Thank
Good
you.
night to everyone.
Thank you.
Shaunak, good to see you.